Yeah, good afternoon. Finally, I raised the hand first for the third time. Finally, I got it. My name is Phương and I'm from University of Information Technology. You know that all my question I want to ask here, Dr. Phương and some college at university. I'm not looking HURS in the small scale, but from a staff who want to invite the criteria of the university. I care about the efficiency of the criteria. So regarding HURS, I still have any concern about the effective in Vietnam higher education. Because as you told, Dr. Jing and a lot of delegates here mentioned that we have a lot of strategy to develop the green university or smart university yes, something like that. But actually when you apply and follow the HURS, I think that we need to change a lot about the policy, making a policy like Dr. I forgot the name, mentioned the capacity of the staff and the leader very important. So in a university, national university, I think that exception University of Health Science, all the rest member, we didn't approach all the criteria of the HURS. So from your experiences, I want to ask you, what do we should do to practice all the criteria of the HURS effectively? For example, how to control, how to manage the health mentor and well-being for both the staff and the teachers in the university, or how we can control institutions and the staff marketing if they don't self-report, and some problem related to that. And because you from the Mahidol and Chiang University, so I want to not the theory, I want to more about the practice from your university, because it's just very simple. If we just put a stick on the score that are 4.5, something like that, but actually in the real university we didn't do any activity, and it's not a burden, but is it feel so trash for the staff or for the leaders at the university if you want to join in the HURS criteria, something like that. So I didn't mention about the theory because it's really clear in the framework. I want to talk more about the practice, and I want to learn and really want to listen your practice in your university. So thank you.
So let me share the experience from Chiang Mai University. We've joined the HURS since 2022. It's been already 3 years. The first year we got 3 stars. 3 stars. The second year we got 4. We expected 5 stars. The third year somehow we got 4 stars. The third. So every year we got questions whether doing this is really help university to improve. First, from the first year, we accept that because we realize that okay, what we have been done or what we have been doing regarding the healthy university, it's exactly like that. We still miss a lot of things, and we see the gap and we see the room of improvement. So next year we learn and we improve by what we are missing. For example, one of the good examples, the questions asks about how many coverage you have across your campus. The idea behind the coverage is that you provide shading for students, for employees, can come to work or can do exercise under different circumstances, raining, sunny day, whatever they can do. We encourage them to do more outdoor exercise. We encourage them to do more activities. So we focus on that. We increase the number of corporate. We take a survey seriously. And then next year we have the result. We survey and we know how long exactly the corporate within the campus. And we submit to the report. And this is one part of the increased score that we earn in the second year. My key message is that first, we don't have to do things new. We just look back at what we've been doing or what we have been done and never been shown up before, like Dr. Vivat just said. And we collect and we put importance into that things. We never thought about government in the campus, just construction. But it's meaningful because it's encourage people to do more exercise. And we promote, okay, now in the campus, you can do exercise more than before. You can go to work better than before. That's improved the atmosphere, the environmental, the ecosystem of the university to put more life into the university. I would say that this is effective of implementing the HURS into the system. So the third year we expect, because we do the same in other criteria, but somehow I got an email with the result. I tried to open slowly, expecting 5 stars at least, and got 4 stars. So my first thought when I read that, impossible, we do everything. And then I sit back and take a look and talk with colleagues. In my group that is responsible for the submission, we have 5 people. The way we work is we ask for collaboration from 46 organizations. We send us the data that we need. At that day, I sit back with a team. What have been done wrong? Why did you get those? We try to track from their comments. We even fight back to the reviewer that we have done this. But finally, we consensus and we see that, okay, something is not really happening. Okay, because we are very much rely on just collecting data to put garbage, to put things that are not really relevant to the improvement. So we have learned and be enlightened that for the next year, 2026, what we have to do is try to clean up first data. But it's also related to sustainability. It's related to sustainability. Because something you just did this year and then you just thought that, okay, we've done already, so we don't need to continue this year. It's still there and we can be useful. No, it is not possible like that. You need to keep doing this and it's become routine in your management. Then you will gain more. So it will reflect the effective of doing this. This is my opinion. I don't know whether it's answer your question, but this is from my opinion.
Maybe I come from Mahidol University. Also, I can share Mahidol University, even though we are our own job as a secretariat office, but Mahidol have been obstruct entries for many years. Because exactly the thing that we have been done, like Professor Jirawat says that, is that we don't try to get the score actually. They just like evaluate ourselves that we are do something about to taking care of our staff and student or not. If we still not do, we just plan to do it. And not necessarily to start up with 22 areas. We can do step by step. There are many universities that join the HURS and they don't declare. But the most thing that they want is a feedback report. from the reviewer, and they check which area that's still not do it, and they just like a behind, because for the declarations of the results, we also ask our university depend would like voluntarily to be announced or not announced, but I found that finally after they implementing for many years, when the score is raised up, so then it means some result is coming more clearly, and so then is this to announce or to show the token? Is this like a reward for the working team? And I said that actually in each university the working team is considered of few people actually, and so then what is how they can do it? 5 people, 6 people, but taking care of the thing, because actually they did not go to serve directly. They just plan for the system, foundation system, just only that.
So my key point is that you need to crack down the 22 criterion in the HURS. Clearly, you understand what is the first criterion, policy making. This is very important. You need to get the organization well understand about the strategies and try to implement it. In the meantime, the lower management level also need to adopt that policy truly and deploy into every single unit. And the result, you come to the evaluator or like the QA group. We are just the people who consolidate or comply all the data. But we know which data belong to which questions. And we answer the question correctly. So this is the key success of it sounds silly. Then you just put the data to get the score. No. Because, to my opinion, during the last 3 or 4 years under the HURS or HURS evaluation procedure, we eventually learn that what is still missing, what is still the gap that we can fulfill, and where is we can get things to fill that gap. So we hope that in the long run we can improve and can live it like that, sustain like that in the future.
Maybe just one point I would like to add on for some university they don't have their own capitals in terms of health services at all. Also in Thailand, the King Mongkut Technologies also is one of very good examples. In the HURS system, if we don't have our own health services unit, because we don't have own hospital, this is not a matter, because in the system they also show that if once the student and staff would like to get the health service, where is it? Just only that. Maybe they're connecting to the city hospital nearby them. Also in King Mongkut don't have the health unit or well-being unit. They ask the Mahidol University to serve in terms of annual physical check-up for their staff. So they just explain like that. So it means everything can just tell the story